We're going to study malignant tumors of the liver, mainly the hepatocellular carcinoma, but also the angiosarcoma and the hepatoblastoma. Hepatoblastoma is the most common hepatic tumor in children. This presents as a abdominal mass, usually fed by the mother, but most of the time is asymptomatic. There is association with Beckwith-Whitman syndrome, in which there is macroglossia, organomegaly, hypertrophy, and Wilms tumor. Also with cleft palate, tetralogy of Fallot, glycogen storage diseases, and this is most common in children before age 4 years. Now the angiosarcoma, this is a tumor that arises from the hepatic vessels, and it is associated with exposure to the arsenic or vinyl chloride. And finally, the hepatocellular carcinoma. The risk factors include cirrhosis. This could be due to alcohol hepatitis, autoimmune hepatitis, non-alcoholic fatty liver disease, infections. This include the aflatoxin of Aspergillus fumigatus or hepatitis C virus or hepatitis B virus, Wilson disease, and hemochromatosis. These are the etiologies. The presentation is abdominal pain, tenderness, jaundice, and the alpha fetoprotein elevation. Even though this is not used as diagnosis, instead it is used as monitoring the treatment and the recurrence. Then sometimes the hepatic enzymes could be elevated, increased transaminases. The liver could be enlarged, so the patient could have hepatomegaly. The diagnosis is with a ultrasound or CT scan. If there is doubt, we can do a biopsy. The screening will be with any one of these two, the CT scan. Actually, it is a 3-phase CT scan. The treatment would be surgical or non-surgical. If it is surgical, this includes the transplant, liver transplant, in which case we should apply the Milan criteria. This is a solitary lesion less than 5 centimeters or 3 lesions less than 3 centimeters. Or we remove half of the liver, the hepatic lobe that has the tumor, so it is a partial hepatectomy. If there is metastasis, we give sorafenib. And the non-surgical treatment includes the transarterial chemoembolization and ablation by radiofrequency. The screening should be done for cirrhotic patients every 6 months. We should also screen women after age 50 years due to autoimmune hepatitis, Asian males above 40 years of age, every African American or African citizen, as well as the cirrhotic patient every six months. So the diagnosis would be with the CT scan or ultrasound, and the treatment could be surgical or non-surgical. This is the most common one. The metastasis is via hematogenous spread. This is uncommonly. There are only 4 tumors that spread in this way, including the hepatocellular carcinoma, renal cell carcinoma, follicular carcinoma of the thyroid, and choriocarcinoma. So malignant tumors is the hepatocellular carcinoma, angiosarcoma, and hepatoblastoma.